Warm welcome to the FEMS meetup session. My name is Pekka Kahri. I'm the coordinator of FEMS project working in Helsinki University Hospital. And in our today's meetup, which is the last session of the autumn series, we will be talking about the young person's engagement in data decisions. Do not worry, this is not going to be our final meetup, so the winter series will start soon after the new year. On January, we'll be having a technical session about the FEMS Federated Network in action. In February, we will be revisiting our benchmarking use case of cardiac benchmarking in pediatrics using federated networks. And then in a March session, we will be visiting the topic of machine learning to improve a rare disease treatment, especially in hemophilia. All the meetups are recorded and they are made available in our YouTube channel, where you find also the previous seasons. The course of this session goes, as always, we will have a presentation. And then we will go into a Q&A session. And for the Q&A discussion session, the recording will be stopped, so you can relax and you can have an informal and relaxed conversation around the topic. Briefly visiting the background of our project. So FEMS project is addressing the urgent need for safe data sharing in pediatrics in order to enable better scientific research with complex pediatric and rare disease patients, which are small in numbers. So even in larger pediatric centers, the amount of data that accumulates is not sufficient for making statistically powerful analysis. We also need real-world evidence on new therapies, which should gather more rapidly than they currently do, and therefore also data sharing and cross-border collaboration is needed. We need to engage more with the medtech industry and innovation ecosystems if we want to make meaningful, reliable and trustworthy algorithms and AI solutions that help pediatric healthcare. And even in some countries where there is one or two tertiary pediatric centers, we need to enable benchmarking, and there sharing data across borders becomes necessary in order to improve treatment outcomes and process efficiencies. And this is where FEMS project was born. We are building a pediatric health data space for Europe in a consortium of 14 partners, which have now worked for a bit more than 2 years out of a 3-year project, with the 7 million euro combined funding from the Horizon Europe program and UK Research and Innovation Agency. The hospitals involved in FEMS project include Helsinki University Hospital, the coordinator of the project, Erasmus Medical Center, and in particular the Erasmus Sophia Children's Hospital, Sant Joan de Déu Children's Hospital in Barcelona, and Great Ormond Street Hospital for Children in London. Also, Mayor Pediatric Hospital in Florence and Children's Clinical University Hospital of Latvia in Riga are involved as hospital partners. Our project also expands to a wider community of pediatric hospitals in Europe through the ECHO, European Children's Hospitals Organization, who is a core member of our project consortium. On the technical front and business part, we have partners from various countries, Tietoevry being a large Nordic IT provider, Aridia providing trusted research environments based in Glasgow, UK, Veil.ai, a Finnish SME providing solutions for privacy-enhancing technologies, the Hive professional services organization focusing on the OMOP common data model and Odyssey tools, and Genesis Biomed, a consultancy in Barcelona, helping our project with the sustainability and business model topics. So with this group, we are building a pediatric health data space, which would foster data sharing and collaboration cross borders in Europe without risking privacy or going against any of the current legislative or governance constraints. But now to our today's topic. So let me introduce you to Begonya Nafría, who is the head of patient engagement in research at the Sant Joan de Déu Research Foundation, where she leads initiatives to actively involve young patients and their families in research process. She serves on the steering committee of the European Young Persons Advisory Group Network, helping to ensure that young people's perspectives are integrated into pediatric research. Additionally, Begonya chairs the Children's Medicines Working Group at the European Forum for Good Clinical Practice, driving improvements in pediatric drug development and patient-centered practices. So I'm now giving the floor to Begonya to talk about the role of young patients in health data decisions. Begonya, the floor is yours.
Great. Thank you, Pekka. Thank you so much. It's for me a pleasure to be today with all of you. And my idea of this webinar, of this presentation, is to provide you the background about how we involve children and young people in health, and specifically have some comments and ideas about opportunities and activities that we can do specifically in the topic about health data decisions. I'm going to take the control of the slides. 1 second. Perfect. First of all, as Pekka introduced, I'm working at Sant Joan de Déu Children's Hospital. This is the institution where I'm leading the patient engagement in research department. And I think that it's important to emphasize that I can do this work in this institution because for us, the patient is at the center anytime. Of course, in healthcare, and we have a dedicated department to work on patient experience, but as well in research. And this is the reason of the department that I'm leading that was set up in 2015. For us, health research, it's not only about basic research or clinical research, it's about as well of innovation and data, because at the end, data, it's around of any research initiative that we conduct at our hospital, but as well from collaborative projects in which we are involved. The mission of the department that I'm leading is ensure that in any of these initiatives in which our institution is taking part or also taking the lead, the patient is at the center. And this means that the patient is involved from early stages, the patient or the family in some cases when it's not possible for the age of the patient or for the condition, from these early stages until any project is finished. It means that we need to build partnerships with them. It means that we need to involve them with the right methodology and ensure that there is a translation, let's say, between the insights, the needs, the preferences that we collect from these activities with patients and caregivers into the research projects and the innovation projects. This is, let's say, the mission of our department. For us, it's essential to do our work, our activities, our projects, respecting, of course, the ethical principles, but as well the children's rights. And one of the most relevant children's rights that we respect all the time, it's the involvement of children and young people in the decision-making process about anything that can matter their health. And in this sense, research, of course, it's one of the areas in which we think that it's important to listen to children, not only the ones that, of course, they will be involved in these projects, as well the ones that can help us to really ensure that these projects are patient-centric. Because if we never ask them, we can take for granted some decisions from our professional background. And of course, we are adults that probably are not aligned with the needs and the perspective of the patients, and probably instead to move this project to a patient centricity approach, probably what we are adding is some bias to the project. For the reason, the patients and the caregivers for us are partners of any activities that we do in our institution. Patients and families, as I said, can be in basic research, and we have had a lot of collaboration with our biobank in some projects and activities, of course, in clinical research, but in any project in which the core of the activity will be the data and innovation. Even sometimes we think that basic research or projects about data can be so far from the daily life of the patients and the families. There is always the chance to listen them and to include their perspectives, because at the end, if we don't have the data of the patients, we cannot do research. If we don't have the samples of the patients, we cannot do research. This is a slide that basically summarizes that you can involve the patients from the very early stages of any project that probably will start in basic research until any project is finished, because depending on the project, we have some regulations and frameworks that require that we return the results of these projects to the patients, and what we need to do it's in the language and in the format that they understand, and also that it's accessible for them. How we design the framework in our institution to involve the patients, it's aligned with this photo that you have on the screen, that is the patient engagement and the patient involvement plan that we set up in 2022. We are now working with the new one that defines some of the principles that you will see afterwards, that summarize how we think that we can involve children, young people, and families in a meaningful way. We don't want to do it because it's fancy, because we can check the box sometimes in some project applications, and we had probably a good or a better assessment of this project. We want to do it in a meaningful way, thinking all the time, not only, of course, in the project, thinking all the time in the families, in the patients that will take part in the project. This plan defines this framework that I already anticipated, and we have a decalogue of principles that ensure that we are working independently of the therapeutical area, following these principles and the model of our institution. The first one is that the involvement of patients in the design of the projects, for us, it's essential, because it's where some decisions are taken that sometimes are so difficult. The change of this decision afterwards, if they are not aligned with the patients or the family perspectives and needs. When I said before partnership, it means in these early stages to co-create or co-design these projects, thinking all the time in the patients and involving them. But not always it's possible to involve the patients. As I already anticipated, we have some conditions in which probably we have a cognitive impairment or other limitations from the patients, or even for the age of the patients, because involve patients or pediatric patients in research and innovation projects requires to have some level of maturity of the patients. And in this sense, the ones that are very young are difficult to be engaged. In any case, always we have the chance and the opportunity to involve the parents or the caregivers. Of course, we need to do it all the time respecting these ethic principles. And one of these principles, of course, it's as the consent and the agreement of the parents and the children to be involved. We reimburse for the time that the participants are involved in our activities. At the end, they are a different type, but they are key opinion leaders, and we need to consider in the budget of our initiatives the cost for this reimbursement. And as I said, involve the patients and the families in the design of the projects. It's where probably their contribution will be more relevant. Diversity, it's another principle that we take into account when we design the patient's involvement activities, not only in terms of the diversity from the medical point of view that some conditions they can have because they have a different, spectrum of symptoms. Also in terms of country, because in most of the initiatives in which we collaborate or we have the leadership, it's not only our site, our hospital or our country participating. And in this sense, it's so important to have patients and families providing this advice to the projects from the different countries that will be represented in the project. And the country diversity, sometimes it's about the healthcare or the standard of care that these patients receive, but of course there are some cultural diversity aspects that also are relevant or important to take into account. Accessibility or any special needs that the patients they will have, they need to be considered. I always say, the same example. If we are working in a condition in which the children have visual or limitations, we need to create the materials and the activities accessible for them. Of course, not all the patients they have been educated to be involved in science, and in this sense it's important to design and deliver the right capacity building programs, the right information or training in order to ensure that they understand which is the topic, the project that they are participating, and how relevant and important is their contribution. And for us, deliver some research in patient and public involvement, this is what stands for PPI. It's important because every project is a new opportunity to learn. And if we can share these learnings, like today in this webinar, probably there are other colleagues from other institutions that in the near future, they can replicate this model or this approach, making more frequent involvement of children and young people in science that at the present moment, still it's a little bit anecdotic. And finally, to do all these activities in a pediatric hospital such as Sant Joan de Déu, it's important to work in parallel with the internal mindset change in the institution. It means to, even if it's necessary to provide training to our researchers, to our clinicians, in order that any time that they deliver any health research project or innovation project, they will consider that the patients or the patient representatives, they need to be part of it, and of course contact, in this case, my department as an expert that can provide the support that they need for these activities. This is only a snapshot about the action plan that we did from 2022 until 2024. As I said, we work a lot in the cultural mindset change. We deliver every year internal training for our research teams in order that they understand what means involve the patients, because require expertise, require time, and require to have some open mind to incorporate the requests, the ideas, or the needs of the patients in these projects. Usually what the patients and the caregivers request to be included in the projects, it's based in common sense approach and decisions, and it's quite easy to incorporate in the projects. And of course, for us, it's important also to work in parallel in this capacity building program with patients and to generate awareness in our institution and with the institutions that we collaborate to ensure that everybody understands the value of involving children, young people, and families, but also to believe that this is possible in all the therapeutical areas, because sometimes it's a matter to believe, and when you believe this, you move into action. For us, it's so relevant to measure the impact of all the actions that we do. As I said, we are doing research in PPI, and we have some recent publications, and this plan was assessed, and we are working in the second edition of this strategic internal plan to involve children and young people in health research. Some key concepts about the areas that this plan covers are these three that you have on the screen. This new science about patient involvement, or PPI, patient and public involvement, basically come from the UK. They were, the children's hospitals in the UK were the first ones to demonstrate that the children can be involved in science. And nowadays we can have, let's say, different level of involvement in science, and according where and in which activities we involve the patients, following the British terms, we can talk about engagement, that basically it's to ensure that we disseminate, we provide information about research, taking into account the needs and the language and the formats that the patients they understand and they can access to. But the core concept here is involvement. And involvement, you have on the slide a definition, but for me, it's equal to this previous concept that I already anticipated about partnership. For us, involve the patients means that they are part of the research team, the innovation team, that from the concept of the project until the project is finished are working hand by hand with the research team. And finally, one clarification about terminology, that it's the concept of participation, that in this new science about patient involvement basically refers to the people, to the patients that are taking part into a research study. They are not the ones that are providing advice, and basically in the area in which we work is in the patient involvement. But of course, any action that we take with these involvement activities at the end generates a benefit, a better experience in the patients that they participate in any research study. Said this, for us, there is a cross-cutting, let's say, area in which we work, that it's advocacy, lobby, probably also we can say that it's full of activities that we are doing with regulatory agencies, health institutions at national level, to really ensure and to work in the direction that will allow the children and the young people to have, an active role in these projects, to be consulted, and to ensure, as I mentioned, the recognition of the children's rights. And one, it's this right to be part of any decision that can matter their health. And the other one that for us it's relevant, it's the right to access to the best standard of care. And in some conditions, we don't have approved treatments, and probably research is the only therapeutic opportunity, even if it's, an experimental research that we can probably offer to these patients. In this slide, we can summarize a little bit all the steps that come from the onset of a research project, that usually it's based in a research question or the identification of an unmet medical need. Here, the patients and the caregivers, they play a very important role, because sometimes from the professional perspective, as we are not living 24 hours, 7 days per week with a specific condition, sometimes we don't know which is relevant and in which area it's necessary to do some research. And you have here all the steps until we deliver, in this case, a research project to study a therapeutic opportunity for patients, in this case for children. And this project finish when we need to communicate, disseminate the results of this project, in which children and young people and caregivers also can help us to do it in the right way. About when involving the patients, and based on the example of clinical trials, that it's in the area in which probably children and young people are more frequently involved. As you can see in the slide, they can be involved in all the different steps, in different activities, from the process to ensure that these protocols are suitable for patients, in discussions about to incorporate some digital technologies in these studies, the process to design the right educational materials or materials for the recruitment. There is, let's say, a big bunch of activities in which children, young people, and parents can be involved. Something that we need to take into account is that every project will be different, and in some projects, they will deserve to be involved more, in some specific activities rather than in other ones. This is an assessment that we do in each project to really identify the areas in which involving patients it's useful and necessary, because probably it's a big burden if we pretend to have, all the patients and the parents in all these activities. It's so important to identify challenges, pain points or areas in which we want to be sure that the approach that we have in our project is the right one, and asking the patients it would be the right way to answer this question. Something that for us it's relevant, it's the analysis of the impact of the activities that we do, because it's the right way to demonstrate that involving patients we could do a better project. And here what we do is to think, depending on the project, which is the best method to do this impact plan or impact assessment plan. For example, in the case of clinical trials, at some point, what we need to assess is the key performance indicators, the metrics of this clinical trial. In other projects, probably the impact assessment plan will be more qualitative. But it's something that helps us to demonstrate, as I said, these benefits. And at the end, it's an information that helps us to include the children and the young people and the families in future projects and activities based on the evidence about what we got as a result in previous projects. Of course, for do all these activities, we need to have in place some administrative process, because we need to do it properly, not only from the ethical point of view, as well from the ethical from the legal perspective. This means that if we are involving adults, we need to have a contract. Sometimes this contract is with patient organizations. We need to ensure that any information that we discuss, that we work in these activities in this session, it's based in a confidential agreement. And we need, of course, to have the right template and document to have this confidentiality agreement in place. And as I already anticipated, we will reimburse the participants. We never reimburse with money the children. We never ask for a contract to the children or a confidentiality agreement, because they are minors and everything needs to be managed with their parents. But we need to have in place these mechanisms for the adults, and of course as well for any collaboration that we can have with a patient organization. How we involve patients in different projects and activities, and of course, there is a big area in which we can work with them about health data with different methodologies. And the process to select the right group of patients to be involved and the right methodologies comes from this analysis that help us to design, let's say, a bespoke plan, project-based thinking, which is the best strategy to get the insights of the patients. We create ad hoc groups of patients and caregivers for these projects. Imagine that it's a specific project in childhood cancer or a specific oncology condition. We need to have the people living with this disease and the caregivers in these activities. But there are other projects that probably what we are working with is a general project. For example, how the children and the young people, they want to receive the results of a clinical trial. How the children and the young people, they want to learn and know the rights about the health data management. These general topics, usually we have two kind of groups to get the insights. One is the Kids Barcelona. Kids Barcelona is the Young Persons Advisory Group of our institution, that it's formed by patients from different therapeutical areas. They have been taught about health, data, innovation, research, all these topics, and they are engaged usually in activities with a monthly based regularity in our institution. And we have a replica, a similar group with parents, that the name is Kids Parents. And for the activities that are not specifically about involved patients, but about awareness and dissemination about the model that our institution it has in regards to the patient centricity in health science, what we have is a large team of research ambassadors, that they are volunteers of our institution, that they support different activities and projects that we do in the dissemination of our activities. This is a snapshot of the website of our young persons advisory group. We have at that moment 20 young people, and usually they are engaged in the group from 12 years and onwards, because in Spain it's the age in which it's mandatory for the national law that we have to request the consent of the minor, the assent. It means that they have the right maturity level to take decisions, specifically in this case for clinical trials, and we translate this age into the right one also to be involved in discussions about science and innovation. And something that for us it's important and relevant is that we work at the European level with similar groups that exist across Europe. Some of these groups are linked to pediatric hospitals like us. There are other ones linked to patients' organizations. And also the institutions that are leading these groups, in some cases, as well as we do, they have the capability to create groups of patients depending of the project. This network, that it's a YPAC net, that stands for European Young Persons Advisory Group Network, was set up in 2017, and the funder members are the Generation R in the UK, the YPAC of Lyon, that has the name Kids France, the network of clinical research in Scotland, and our group based here in Barcelona. And at that moment, we have experts, colleagues, and groups across more than 14 European countries, and we have more than 30 different groups of young people that are already established, and they are ready to be involved in projects in which they can provide the perspective of young people, or in some cases patients of a specific condition. Of course, work in pediatrics means that for some projects, as I said, we need to create these other groups of patients, and in the case of Sant Joan de Déu, we have the capability to cover all the pediatric or subspecialties of pediatrics. Also, we are a maternity children's hospital. It means that as well, we are working in projects of research and innovation with pregnant women, and we involve this target population. In some projects as well, we work with colleagues with expertise in adults, because you know that teenagers sometimes can be involved in projects addressed to adult patients. And for us, it's important and relevant, this approach to work together with different regions or countries around the world, because it's quite rare that a project in pediatrics only will be conducted in one institution or one country. And this diversity perspective that I already presented, for us it's important, because sometimes the insights at country level are the ones that we need to take into account. Probably the protocol or the project will be the same, but this country diversity requires to take into consideration some adaptations for these groups of patients. In terms of methodologies, we work with different ones. Here you have in the slide focus groups, the Delphi methodology, questionnaires, interviews, advisory boards. But for us, let's say the most meaningful methodology that also allow us to work together, not only to get the insights of patients and caregivers as well from the health professionals, it's simulation. We have the capability to simulate some activities that probably will be challenging. And if we don't anticipate and replicate these activities before to move to the real world, sometimes, it could be a problem there. We need to amend projects, and, the patients are there waiting for a project that requires to respect or to allow them the maximum better experience during their participation in the project. We have some activities to assess the quality of the projects that we do, surveys, questionnaires, and anytime that we do these activities, we provide some acknowledgement, and we return the results to the participants in these activities. We work closely with patient organizations because it helps us not only to work with our patients and families, as well with families from other regions of Spain and at the European level. I already commented that for us it's key to deliver training to patients and to the staff. And this piece about research in the patient and public involvement field. We try not to publish as much we can the results of our activities. Specifically about the topic of health data and in regards to the concerns of the young people, this is an area in which I think that it could be interesting to involve more the young people and the patients, because as by law, they are minors and anything needs to be managed from the parents or caregivers' perspective. Usually they are not consulted. And this is something that we need to take into consideration. When we ask the young people about their rights, some of them they know, but in general they are very conservative in terms of privacy, the use of some technologies, and something that for them, it's important. It's to know anytime about the use of this data, and in general this is not a common practice. Here in the slide, you can see some of the areas in which some research has been done in terms about the health data and young people. It was a survey conducted with more than 6,000 participants from 8 different countries. And the topics that were asked these young people that contribute to the questionnaire were about security, the misuse of the data, transparency, the individual control about the data, and the impact on research. I want to encourage the FEMS consortium or the different partners now or in the future to explore more about what are the concerns, the needs, and expectations of the young people in regards of a topic that in the schools also they are not teach, and it's a topic that affects everybody, and not only for health data, for any other personal data that other institutions they have from us or that we are managing on different platforms and technologies. Some ideas about where we can involve the young people, specifically in the field about health data. They can help us to co-create ethical guidelines. At some point, they are part of the decision-making process of any activity, any project, and they need to know about the ethic principles and the rights that they have. Of course, review any consent or assent materials. We did in the past an activity for the ERNs, the European Research Networks, in which even if it's not mandatory, they wanted to promote the good practice to ask the young people about the use of their data in the context of the ERNs. It's nice as well to involve young people in some governance structures, because probably they can give ideas about how we can disseminate, educate, and share the rights of the children and young people in regards about health data. These are only some ideas. They can help us to develop educational materials, of course, anytime in the format that they prefer and they like it, that it's based on the use of social media, infographics, animations, etc. They can help to pilot digital tools, and we are surrounded by these tools in our mobile wearables, etc., and also activities to advocate for the children's rights, not only in health, of course, as well in the topic of health data management. And in summary, everything that we do in the area of health science, research, and innovation, it's addressed to answer and to respect and to recognize this right of children and young people that I anticipated at the very beginning of this webinar, that it's based in the principle that the children, when they have the right maturity level, they have they need to be consulted. We need to listen them and allow that they can have the opportunity to express their views. for us, let's say, and even it's not a legal document, but the driver of anything that we do, it's the Convention of the Rights of the Children that was published by UNICEF in 1989. And this is all from my side. Happy, to answer or to comment any question from your side. Thank you so much.